I'm gonna get started in about 1 or 2 more minutes. But yes, please keep on putting your answers in the chat. Your name, what ward or organization you're representing today, and why is air quality important to you? Or yeah, can everyone see my screen? Okay, okay, I got some
Yes.
thumbs up. That's good. Hopefully, it stays this way. I think we could go ahead and get started. We have a tight agenda, so I definitely don't want to keep you all too long. But welcome to our air quality event for this Earth Month. My name is Anthony. I'm the environmental justice organizer with Empower DC, and we've been working closely with DOEE and the mayor's office to host the city's air quality advisory board, and we'll talk a little bit more about all the different things that we've been working on for these past 6 months and some of our concerns and whatnot. And yes, thank you all once again for being here with us today. This is one of our events for a series of events this Earth Month. So we're about halfway through our Earth Month series. So we definitely do appreciate you all. Hopefully, you all have attended previous events or will be looking towards attending some of our other events this month as well. And we'll definitely talk a little more about that later in the presentation. We're also joined by some DOEE staff who will, give us a nice presentation. And yeah, we'll go ahead and get this thing moving. So, like I said, for this agenda, so again, if you can please introduce yourself in the chat, your name, what ward or organization you're representing, and why do you care about air quality. This meeting will be recorded and we will be posting this on our YouTube page. So don't feel like you need to take any crazy notes or anything like that. Just be fully here and engage, and we'll upload it for everyone. We will have a quick presentation from some of DOE's air quality staff to talk about, air quality 101 and some of the tools that you all can plug into to kind of measure air quality within your areas. We'll also have introductions of our amazing boards by myself and Joseph Jakuda from DOEE. Like I said before, recap some of our board's activities, and then towards the end, we'll have a kind of open conversation with you all with some of our board members. So today we have Dr. Janet Phoenix and Miss Linda Brown, who will be leading that discussion. And we also have some of our other board members here joining us as well. So don't be afraid to chime in as well. And like I said, that will kind of lead into our broader group discussion. So with that, before I pass it over to DOEE staff, I just wanted to remind you all of Empower DC, just in case you all don't know who we are. We're an organization, a nonprofit here in DC, been operating since 2003, focusing on environmental justice and public housing and DC history within the city. Our mission, our vision is that, we believe that DC is a state where human rights and needs are met, and addressing systems and exposing repairs and building empowerment amongst our residents to shape decision making that impacts our lives, and to really build that community power amongst our residents to address racial, economic, and environmental justice within our city. And more specifically amongst our environmental justice work, I definitely want to center us as we talk about air quality. We can't really talk about air quality without talking about cumulative impacts. And what this means is cumulative impacts it looks at it combines stressors of different types of things over time. So that can be, air quality exposures, but just any other pollutants as well. It could look at health. There's some other social economic variables as well, and kind of those impacts over time and how those multiple stressors are impacting our communities. And most of our overburdened communities have been impacted due to this stressors. So two examples of that is in our city, how we cite our industrial use. On this map on our left, this is a map of our Office of Planning and where all of our industrial sites are cited. A lot of it is concentrated in wards 5, 7, and 8. A lot of it, 50% of our total industrial land in our city is concentrated in wards 5. And because of this industrial activity, it kind of impacts our urban heat island effect. So a lot of our communities that are in over-industrialized areas are seeing temperatures up to 16 degrees hotter than the rest of the city. When we are talking about air pollution, a lot of this other chemical pollution kind of and the heat kind of exacerbates our exposure. So, we are going to see a lot of health issues over the summertime, as it relates to health and air quality. So, with that, I definitely would like to pass it over to DOE's team, Kane Samuel and Henry Fishman, to talk a little bit more about air quality within the city. So if y'all are ready, we can pass it to y'all.
Thank you, Anthony. Do I have screen sharing
Sharing
privileges?
privileges. Um,
Yes, you should.
I believe you do.
Yeah, I do. If you all can see my screen, just give me like a yeehaw. I don't know. Oh, and gonna make sure I'm not coming in low either. Yeah. So my name is Kane Samuel. I'm gonna give like a little bit of information about like the air quality, like one-on-one basics before we kind of get into the meat of this presentation, which is on our District Department of Energy Environment's Air Sensor Lending Program. So, can folks hear me? Like, can we hear me pretty well?
Uh,
Okay.
Can you speak up a little bit, please?
Yeah, I'm trying to do it without screaming. Can you hear me? Yeah.
Yeah. Mm.
Oh, okay. So yeah, I'm gonna go over like some of the air quality like one-on-one basics before we get into the rest of the presentation. So this might be commonly known, but I tend to ask people a lot like, what is air quality? Uh, when you think of that question, just think of like how clean or how polluted the air is, right? And once we start asking that, we have to also ask ourselves, what affects air quality? And so we have human activities. When we think of human activities, think of transportation. So cars, buses, trucks, they all release pollutants like nitrogen dioxide and carbon monoxide, unhealthy things that can really make air quality really bad. There are industrial activities, so factories and power plants, they emit chemicals and particulates into the air. So also negatively affecting air quality. There's agricultural activities, so like farming and things of that nature. Burning or uses of fertilizer can release gases and particles in the air, which has a negative impact on air quality. And there are residential activities. So this is me pointing the mirror back at you all. So think of like heating and cooling systems, especially like the ones that burn like fossil fuels. They can contribute to poor local air pollution. And there are also some of the natural factors that people might not have considered. So temperature plays a role in poor air quality as well. So when there's like a temperature inversion, which is basically when there's a warm air layer of warm air trapped between two layers of cold air, pollution can get trapped at the surface and like can't move around, and we can really feel the effects from some of these human activities. You have wind, which can kind of go either way. So wind can either bring in clean air or it can bring in dirty air. So that can be like a positive or negative influence on air quality. And then you have like more positive things like trees and like other vegetation, which can clean the air and but also release like some natural like compounds like VOCs. And like probably one of the worst involved, you have like wildfires. So think of like 2023 when you had all that Canadian wildfire smoke being brought into DC, had a really, really bad impact on air quality in the district. So let me go into the next one. So with all these like like sources of poor or good air quality, we have to think of like ways where we can convey this information to the public. And EPA came up with this really cool tool called the Air Quality Index. Many of you are familiar with this if you sat in a presentation that I've given or like EPA or whoever. And it was just something created by EPA to kind of like come up with a color coded system to convey either how good or how bad the air quality is. It ranges from good to hazardous. We want to stay within the good range. And, some of those sources that I mentioned in the previous slide can kind of bring us up to yellow, orange, or even like red at times too. And way you can access this would be through the weather app or going on EPA's airnow.gov website. Um, yeah. And you have someone like myself. So what I do in the district is I do air quality forecasting. So what I'll do is I'll take air quality information being collected in real time from the various monitoring stations in the district. Um, I'll spend maybe a good portion of the day looking at weather maps, trying to see how various weather patterns are like, going to look over the next few hours. And, we utilize even some predictive models to, assess how good or how bad the air quality is. So like, machine learning and AI, things of that nature. And, myself and also in that image is Monet Scott, who also serves as our air quality forecaster. Will make these predictions, sit on a call with Maryland and Virginia, and then put these out 3 days at a time, and on the weekends, 5 days at a time. Below, you'll see a link for Environmental Flash. So if you ever want to make sure you stay up to date on a lot of these alerts, you can sign up for that and just get them pushed to your phone via text message or email. And it just kind of brings me to like the next portion of the slide. So, we're collecting all this data and, we run a pretty robust monitoring network in the district. But as you can see based on this map, there are visible limitations. Um, in this map right here, we have the monitoring stations. They're highly effective, but they come at a high cost. Like these are pretty expensive instruments. There are a lot of placement challenges because they're so massive. Like you just can't put them anywhere. And like when I talked about those identifiable gaps, there's very limited neighborhood representation because of like some of those constraints that I last mentioned. And now I'll kick this over to a partner and refreshment, who will kind of go in like ways we're going to address some of these gaps.
Whoa. Why don't I share my screen just so I can control the slideshow?
Yeah.
So this would be screen one right here. Can everybody see this?
Yep.
Yep. Yeah, great. Okay. So we just talked about kind of the limitations of our current monitoring network. And so let's kind of address the solution, which so we're looking to expand our monitoring with these low cost sensors. The two highlighted here, the ones we're using. The one on the left is a clarity node. It's just a bit fancier. It measures a lot of different gases in addition to that particulate matter that, like the dust you see, the wildfires that come through, that's all particulate matter. And on the right is the purple air sensor. It's a bit smaller and a bit simpler. It just measures particulate matter in addition to things like temperature and humidity. So what is the point? Why compare them? Why talk about them? Well, so the big ones are very fancy, right? The one on the left, the high cost sensors are very fancy. They're very nice, but they're stationary, and they can't you can't move them around. They only cover kind of that area. The ones on the right, low cost sensors, are kind of the opposite. They can cover pretty much anywhere you can place them. They're much more dynamic in that sense. They have a little bit of a shorter operating lifetime. They're a little less accurate. We're looking into ways to kind of getting around that, but the trade-off is that you can put them wherever you'd like. So we basically, our goal now is to understand air quality at a much more local level, right? So there was that network before that covers these specific areas, and this ideally should cover the whole city. But as we start to look at local areas, we want to look at places like schools and other places we might have gaps in our network. We're going to use these sensors, these low cost ones, to measure particulate matter and create like a larger map of the district's air quality. And then from there, we can use that data to kind of find pollution sources that maybe we weren't aware of or didn't have sufficient data on to act upon. And then we can work towards, of course, making everybody healthier through that. And so to do this, we're actually giving away sensors. If you live in DC, you can get a sensor for free. It's entirely free. We come by, we install it on your home, and then you can look at your air quality whenever you'd like. And it helps us because it expands our network. And so we can identify areas that maybe shouldn't have the air quality they do. So we have a network going. This is a map on the right. We've already deployed a ton of sensors, but there's still gaps, right? We still have some gaps to fill. And so if anybody in this call is interested, there's just a few things you need. You need to have a power connection. So it needs to be a plug on the outside of your home, preferably facing the street. Like, right, we like to deploy them at the level that people are generally walking and existing on, not like the second or third story. And then facing the street because that's where a lot of the air pollution is coming from. It needs to have a Wi-Fi connection because that's how it's sending the data to us and how you can check it. And then we ask that you simply just make sure that it's not broken. Essentially, walk by it. If you walk by it, you see something's off, you let us know, and then we ask you to sign something, essentially just confirming all of this. And it's important, right? There's a lot of things that can come of it for you and us. For everybody, it's you basically allow us to understand your community and what the air quality is like there. And if you believe your air quality is poor, this lets us know, right? And then it could also identify potentially the source of that poor air quality. And additionally, it just allows you to better understand your air quality and what that means. A lot of people in the city have asthma or other lung conditions. Having a number to say, hey, today maybe wear a mask. Hey, today is fine. Hey, today maybe stay inside. Can be incredibly helpful to take care of yourself or your loved ones. So if anybody has any questions, feel free to ask them. Feel free to also email any of us. I can also put in the chat right now the links to the website that talks about it. There's a whole website we built out. And then additionally, I can also put in the chat the sign up form, which is also available at the bottom of the website. But I'll also just send the link directly to it if you are feeling so inspired and ready to just sign up right away. I see a hand up.
Yes, are these sensors available for all the wards in DC?
Yes, they are.
All right. Well, thank you all so much for that lovely presentation. We will have some more time for questions and answers towards the end, but I definitely want to move us right along. Next, we will have our Associate Director of the Air Quality Division at DOEE to kind of give us a background of the Air Quality Advisory Board. So with that, Joseph, you could go ahead.
Thank you, Anthony. And I just want to let you know I dropped also the map to the purple air sensors, which isn't just ours; it's every single purple air sensor into the chat if you want to take a look at where we have coverage. But today I'm here to talk about the Air Quality Advisory Board. This was a project that stemmed from ARPA grant that was competitively awarded, and the idea was that we wanted to have a different, more inclusive approach to installing air quality monitoring sensors and communicating air quality with the public. There's sort of a couple of major aspects to this project. One, we're going to be installing I think we're out now up to 4 of these park bench monitors. If you've ever been to the National Zoo and gone to the petting zoo part, there's one there already that was from a previous project where it's essentially a park bench with solar panels and air quality sensors. And so it allows people to both, rest like a typical park bench, but also learn what the air quality is. So that was the first part of the project. We also wanted to use that data and all the other data we had to better communicate what current air quality levels were through a mapping exercise, so that way and the EPA tools are only really available for our federal monitors, essentially. So while obviously if you live near a federal monitor, that's all well and good, but the gaps in between that we've been talking about already, this will help fill some of them in. So this mapping tool would expand upon the federal network that would have these park bench monitors. Plus, we're also going to integrate the purple arrows and some other sensors that Henry and Keen are working on. And then the third part was to tell people stories. We wanted to make sure that folks have experienced air quality throughout the district. As some of y'all have been around here for many years, growing up in Ivy City or down in Anacostia or Buzzard Point, wherever you've been and experienced the air quality. So we want to understand the stories of district residents when it comes to their experience with air pollution. So those were sort of the 3 main parts of the project, but we didn't want to just say, hey, we're the government, we know what's best. We wanted to make sure we were putting this all together with impact from everyone, from y'all, So that's where the idea of the Air Quality Advisory Board came from. So the idea would be a board led by district residents, with district residents participating to help make these decisions collaboratively. We obviously did want to make sure everything was grounded in the science. We know that there's certain limitations upon what we can monitor and where we could install things. And we also wanted to make sure there was a community-driven element. So these weren't going to be at someone's house. They had to be publicly accessible and whatnot. But beyond that, we wanted to make sure we were hearing from everyone. So that's where Anthony and Empower come in. We partnered with them to manage this air quality advisory board, hear from district residents, as well as a few scientific experts that were on the board, in order to determine recommendations for bench placement, tech tools, the whole 9 yards. And it was a really great model. I think we've told other folks in other agencies throughout the country about this. And I think this is a really great way to start working better to collaboratively to solve some of these problems that we're seeing especially in certain communities that have been underserved over the years. So I think that's all I wanted to say at this point. So Anthony, if you wanted to take it over, and I'll be on for questions when the time arises.
Thank you so much. Yeah, so I'll continue chugging right along. Sharing my screen again. One sec. Present. So yeah, so as Joseph just mentioned, we had a combination of residents and experts who participated in our board. So I definitely wanted to uplift and highlight them because they've done amazing work this past couple months, and I really do appreciate all the things that they've done and all the things that I've learned, participating and working with them. So first off, we have Miss Belle Perkins representing Ward 1. We have Miss Sharon Edwards, who's again today's birthday, and our youngest board member, Makai Brooks, who's pictured here on the left, who's in college right now, who participated. We have Miss Rhonda Hamilton and Miss Linda Brown, who we'll hear from later on, representing Ward 6. We have Miss Tanae Lewis representing Ward 7, and we had Miss Carol Hawley and Miss Brenda Lee Richardson representing Ward 8. And then from our expert side, we had Shizuka, we call her Zooks, Shay from Trinity Washington University. We have Valentina Aquila from American University. We had Dr. Janet Phoenix from George Washington University and the Campaign to Reduce Light Exposure and Asthma. And then lastly, we had Nsay Witherspoon, Children's Environmental Health Network. So I definitely want to give a round of applause to these amazing board members. I definitely, again, enjoyed working with them, and hopefully we can continue this partnership and, striving for a better city as it relates to air quality and much more. So again, going into, some of the things that we worked on. So first, we spent the majority of our first part of our board, coming up with recommendations around the air quality web tool that DOEE will be building out. And, for these next two slides, just highlighting some of our, high level recommendations that we gave to DOEE. First of all, we definitely want this tool to be accessible and very simple, useful for everybody, and really integrate, some of that base level, health information and health impacts, and, really incorporate some educational videos as it relates to, learning more about how air quality is impacting our residents. DOE is also already kind of doing some of this work, but again, just making sure and reaffirming that we are providing alerts to residents, especially our most impacted residents, as relates to schools, rec centers, and again, areas with high impacts, and, really understanding and kind of fleshing out some more decision-making protocols as relates to alerts. We also have a section as relates to policy impacts, so making sure that not only DOEE is using this data, but all of our agencies are using our air quality data because they all they all do have an impact on our air quality. Not just DOEE. The monitoring is kind of on the back end, but how do we are also using this data to prevent more air quality from impacting us? So as it relates to planning and zoning, as it relates to the permit process, and also having a equity focus. We are thinking about our most impacted populations and really trying to uplift them. And using our federal monitors, so Kane mentioned the AQI data. How are we using that AQI index to make sure that we're looking at our operations within our district and trying to lower those standards. Um, and then our next couple of recommendations also looked at community engagement. How are we getting to the communities? What type of information are we passing out to the communities as it relates to air quality? How are we using 311 complaints and the 311 enforcement dashboard to uplift air quality issues and address to alleviate a lot of our air quality issues? And how are we being more transparent and accountable and having better oversight about what is happening within our communities? How are we using this data to look at the gaps, but also how do we amplify enforcement and accountability within our own district government? And displaying permit info and knowing when upcoming permits are happening within our communities, and including community feedback, not when it's too late, but at the beginning of every process, during and after, to making sure that our communities are safer. And lastly, there are, Joseph has mentioned, Ken has mentioned, there are a lot of federal tools that already exist. So, how do we leverage those tools to make sure that we are looking at our, combined cumulative exposures, within our communities? So on the map on the right, we have this CDC's Environmental Justice Index tool, and that looks at overburdened communities and looking at some of those factors that I mentioned earlier, combining the health, combining the socioeconomics, combining the asthma rates and whatnot, to making sure that we are also being more integrationally focused when addressing air quality. So again, combining different indicators like asthma and maternal health, and using overlays like the hyperlocal monitoring. This was another project that DOEE was working on, and making sure that we're including some of that data on our more hyperlocal side within this tool, but also partnering with not necessarily the EPA, but using the existing data, but partnering with our Department of Health and our other agencies to making sure that we are fully addressing air quality and all its impacts. Um, so as Joseph and Harry mentioned, we also discussed about new placements for park bench monitors. In the picture on the right, you can see what a park bench monitor looks like. This is the one that is at the zoo. And these bench monitors are able to, measure things like nitrogen dioxide, potentially black carbon, ozone, and other small sensors like the PM 2.5 sensors. And, we kind of, we looked at different web tools, that other countries are using. We also, looked at, not countries, other states are using. We looked at, kind of where the need was and where we would like to see, some of these park bench monitors to be at. So, our first kind of round of recommendations were, these sites listed to the left. So we had the Alexander Crummell School in Ivy City in Ward 5, the Deanwood Recreation Center in Ward 7, the Pellwood Library in Ward 4, and the Berry Farm Recreation Center in Ward 8, as to kind of start. But then, as you can also see, there's some monitors highlighted in red. Those are monitors that you will mostly probably find, west of the Rock Creek Park. And we decided that we definitely one monitor is not only in what we would say in the most hazardous areas, but we also want to show other monitors in the better sited areas too, to kind of show that disproportionate impact of what we're seeing in our most impacted areas and what we're seeing in our most cleaner areas. And then these other slides are just kind of further recommendations, because as Joseph mentioned, these benches can move. This isn't just a end all be all with some of these locations. We could also think about other locations that we may see gaps in that we would like to have park bench monitors. Another thing that we worked on, we worked with the communities across the whole district to collect stories of people impacted by air quality. So this was an amazing project that we worked on. You know, we had about 21 stories collected, and I have a little treat for y'all. This is the first time where we're showing one of the videos publicly for you all. So I hope you all enjoy. Yeah, and let me know if you can't hear it.
I don't know if I can
You
hear it.
can't hear it.
Yes.
Can't hear it.
Okay, 1 second. Let me go back because I might have not pressed the button.
Clean air to me will be less commercial vehicles in my neighborhood, more trees in my neighborhood. So when they rebuilt this neighborhood, when they did all this, like we had a lot of trees around here one time. It wasn't a lot of houses. So when they built the new houses, they took away a lot of trees, a lot of green. Well, it wasn't considered green space, but it was a lot of trees around. And they put houses, but they ain't bringing them back. Like we definitely need it. We need some shade. We need to be able to not smell the school buses, small, what is smug, the government vehicles, like that's what we need less of. They don't have to go completely, but we need less of it. In 2018, when there was a fire at the chemical facility, I don't think nobody knew in the city. Like nobody in our city knew that where the fire was at. Like it's fire trucks around, we can't get down the street, can't go up the street. When it came out that it was a chemical facility, it's like, how bad could it have, like how in danger was our lives? You know, it's like, it's chemicals. How dangerous was that for us? Like, how bad was that to have burnt chemicals in the air? Could it have been worse? Like, but where did it go at? You ain't see about on no news, you ain't see about on no paper. Like, I don't think I knew that it was a fire there until probably 2 days later, that it was actually at the chemical facility. It's like it was being hidden from the beginning. It was crazy. So it definitely was a bad feeling. And then to see, after doing research and getting the chance to see the photos and stuff of this, it looked bad, man. It looked bad. It looked bad, real bad. Like it was a bad feeling. It wasn't a I'm at home safe feeling. It's like, man, these folks threatening my neighborhood. Like I felt like I was in danger. My biggest thing to address air quality is less commercial vehicles. We don't have to, like, we have commercial vehicles on. Once you turn off on any street, it's commercial vehicles. Or you got the buses, you got the what's the name, trucks on Fenwick, then you go on Gallaudet, you got more trucks. You go across Virginia Avenue, you got more trucks. It's just like, give us a break. Break it down in half, man. Spread this out. Show some love to other parts of the city. Don't let us get all the love. The biggest thing all I say is, man, we need more green space. Like that's the number one. You know, we got to pop. We gonna get some more, but it's like we need grass and trees. You know, we need them bad. Like, you know, like I say, I don't smell too much, and I got bad sinuses, but I think a little bit more trees might help a little bit with some of my scents. You know, I gotta deal with it, but you know, I want my grandkids outside smelling and not smelling later on in life. You know, so it's one of the things, man. Give us some more trees. Like, let us take some of these trucks away and let us get some more trees in the neighborhood. You know, replace the trucks with trees. That's about it.
Sorry, I couldn't unmute. But yeah, so we have about 21 of these videos. And yeah, we definitely would love to do more projects like this. And, we definitely heard a lot. This was Chester Harrison, from one of our Ivy City residents. He talked about a lot of different things. It wasn't just the trucks, it was the smells, the odors, it was the lack of green space, the lack of a lot of different things. So when we talk about cumulative impacts, is the combined exposures and the combined stress, people are experiencing, it's the traffic, it's the pre-existing health issues that are already happening, and a lot of these things are impacting residents later in life. A lot of other residents also share the same sentiments, where they're growing up in a certain neighborhood and their health impacts are getting impacted later on in life. Or if there's a lot of projects and construction projects happening in one centralized area and how that's impacting folks. So with that, just to wrap this up before we transition to our next phase of our meeting today, is kind of our general recommendations that we're building out for the DOE staff. A lot of our board's recommendations are centered around, community engagement, communications and education, health and public safety, enforcement and accountability, data and monitoring, and permitting and planning. So it's not just the monitoring, it's a lot of other things that are also impacting us. And, we definitely want this to be a very, very high level thing that we're starting to focus more and more on, as a community. So we definitely want to hear from you all before I turn it over to our board. Um, to first of all learn more about what other recommendations that you all may have for the DOE staff, and the board members definitely wanted to get more public input about this to incorporate in our final recommendations. So Medita will be dropping some links in the chat to work on a survey to get some of those recommendations for us, so we will incorporate into our final recommendations. And then we also, want to connect with you all too. This isn't the last time we're going to be engaging in air quality and, making sure that our city is safer and cleaner. So if you do want to learn more, want to connect with us and want to join some of our campaigns, we also have an interest form that we'll be dropping in the chat. I will also be emailing these forms out after the event. So you will also have it in your email. So don't feel pressured to try to complete and save everything right now. I will send those out as well. And with that, I would like to bring up Miss Linda Brown and Dr. Janet Phoenix, if you all are on, to kind of share, some of your, first of all, your experiences and kind of anything you all like to share about your concerns around air quality, but also your experience on the board. Um, so yeah, whenever you all are ready.
You called
Hi.
Linda's first.
Oh,
Go
you
ahead,
can go ahead,
Linda.
doctor. You want me to go first? Okay. Hi, I'm Linda Brown. I live in Ward 6. And the reason this air quality is so important to me and I join is the health and public safety. I have a daughter who is disabled, and so she also has asthma. So at one time here in Southwest, there was about maybe 3 or 4 construction projects that were going on at one time over here. So we also have the stadium and the baseball stadium and the soccer stadium. So on days, the games, there is a lot of traffic. And in the summertime, the heat, the index quality, that's terrible. So you can barely go outside. So that's very difficult. And so it's important to me that we come up with ways to make sure that we can be outside, especially in the summertime. Everybody want to be outside. So to make sure that my family can be outside, because I know now here in Southwest already there's a lot of trees. So the pollen has already gotten to us already. Everything is like covered in green. So it's really difficult. So you can't open your windows. And I really don't like artificial air. So we like to be able to open our windows so that we can have that fresh air quality coming in, but it's very difficult. So I also like to know or stay in touch with Anthony and on this project about health, because I know in the summertime, a lot of our children are in the emergency room. So it's real important that we um, come to some solutions about how we are going to deal with this air quality so that we can be outside. And I think those benches that we're talking about would be great here in Southwest where the stadiums are. There's this circle to be able to put one there to measure that air quality there that's coming across the bridge. So that would be perfect for a place to put those benches. So I really would like to see us come to some solutions to this air quality, because having to be closed in our homes, it's really stifling to me that we can't have any air coming through our windows because of all this pollen and pollutions and air pollutants that comes through the window. So I really would like to see that something happen on that. Being able to come up with something where we can, whether the screens, I know at one time the developers were passing out the air qualities for the house, for the room, to clear the room of pollutants and stuff like that. But that's not enough. Yes. So that's why I am here today.
Thank you, Miss Linda. Dr. Phoenix?
So I guess I'll go next. But let me say that I really have appreciated the opportunity to serve on the Air Quality Board. And I wish we could, kind of continue in some fashion, because I think it's been really useful for me to learn. I would not have characterized myself as an air quality expert prior to joining the board, but I do feel that I've learned a lot in the process, and especially having conversations with folks from DOEE who've shared information about the programs and activities that they're engaging in to try to better measure air quality in the district. I really come at this kind of from a health background and with a health focus, because I work with a lot of families who have children with asthma in the city. And I do believe strongly that some of what's contributing to the asthma attacks in the children in those families is being exposed to air pollutants. It's not the only thing, but it's definitely a big thing that's contributing. The poor air quality is making it more difficult for families, for the children especially, to go outside, to play, to get to school regularly so that they can learn, and to stay out of the emergency room in the hospital. The air quality is really having a negative impact. And I'm pleased to see that the monitors are springing up in places where they hadn't been before, to complement the regulatory air monitors, which are kind of few and far between in the city. I think there needs to be more of an effort to really kind of cross-fertilize, get the health people talking to the environmental people more and working together, especially to look at the health data, because being able to look at some of the new air quality information that's being collected with the newer monitors that are being rolled out, whether it's the PM sensors or the park bench monitors, whatever it is, to be able to take that information and to be able to coordinate that with the health data that's being collected by healthcare providers like Children's National, for example, which keeps a record of all of the asthma-related emergency room visits and hospitalizations for children in DC. We really need to kind of mine that data and look at the patterns that we're seeing. Certainly, we see a pattern of high rates of visits to the emergency room along the 295 and New York Avenue corridors. And those are the same places where I think we're seeing higher levels of these air pollutants that are being measured by the monitors. But it's being able to kind of tell that story as one story. And I think the environmental agencies tend to be working, in their silo. The health agencies are, up to their necks trying to keep the kids cared for, and they're not necessarily working together to really try to plan and reduce some of these things that are making the kids sick. And this is making adults sick as well. I work with kids, but I know that this is affecting adults as well, people with chronic bronchitis, people with heart disease, people with COPD, the elderly. A lot of people are affected by this, not just children. So those are some of my recommendations that, we really need to figure out a way to allow for the Environmental Agency, for DOEE, to work more closely with DC Health to really address this. And the other agency that seems largely absent from this conversation is the Department of Transportation. Because they are responsible for these traffic corridors and, really need to be engaged so that, they can start planning for ways to reduce exposure for people who live along these transportation corridors. I don't live in the district anymore, but I grew up in Ward 7. I grew up really very, very close to the monitor that's on the roof of River Terrace. And I grew up close to the Pepco Benning power plant, which thank God is no longer operating as a power plant. But that was a big source of exposure for us as a family. And there are sources that remain. When I drive into the city, I drive along 66. It's the quickest way for me to get from where I am into the city. And I see these barriers along 66 that really help to protect people who live in the communities along that highway, Falls Church, Arlington, from some of the traffic-related air pollutants. I do not understand why we cannot put similar barriers in place along some of these traffic corridors in DC to try to help reduce some of the exposure for people who live, work, and play beside these highways. There are chain link fences that separate 295 from schools, homes, old folks' residences, businesses. And it just makes no sense to me that we don't work very hard to protect the inner city in the same way that we protect people who live in the suburbs. So that's all I have to say. I still don't consider myself an expert on air quality, but I know a few more things now than I did at the beginning of this process. But our work is not finished. And so we really need to figure out a way beyond perhaps the lifetime of this board to continue to work with residents who are impacted in all parts of the city, Southwest, Northeast, Southeast, the area around Ivy City, Brentwood, because the sources are still there. They've been there for a long time. They're continuing, and we have not yet figured out a way to address some of these sources in a way that will really reduce these hazardous conditions for people living in this part of the city.
Thank you all so much. Let's give a round of applause to Dr. Phoenix and Miss Linda. Like I said before, I definitely am appreciative of not just you all, but the whole board. I will open it up for some questions and answers, but I also want to leave space because we do have some other board members on the call as well. So if they wanted to share out, I see one's already ready to go. So go ahead, Miss Tanae.
Thank you so much, Anthony. You knew I was going to say something. I just couldn't present because I'm on the train and commuting home from work. But everything that's been said, I echo it, I underscore it. I want to just lift up as well that we need to begin educating the children that are in schools. I know that I've been in some emails this week in trying to start that conversation up, but we should be teaching the younger children the importance of better air quality, how to mitigate some of these risks because it is impacting them. And as we know, like the ones that are harmed doesn't have a voice. But if we start educating them and they would be very impactful in giving testimonies to council members and other agencies. And so I think that that is a gap. As Dr. Phoenix said, we have a lot more to do. I think that's a gap that needs to be bridged here in the city. And I am looking forward to continuing to work with DOEE, Kane, Henry, Joseph, on seeing how we can get this information or build out curriculums in the school, and working with educators to ensure that everyone is informed, not just those that are connected to environmental groups. And I will also say, as an advisory board member, this experience has taught me so much. I've recently had a purple air monitor installed at my home in Ward 7. And so it helps to know that I can go online and see what how the air quality is on any particular day, because my daughter also has really bad asthma and everyone in my home has severe allergies. So it helps. And it's been great working with the awesome Empowered DC staff along with the other board members. Thank you.
Thank you, Tanae. But yeah, I definitely want to open it up for any of the other residents. If you all have any questions or comments, reflections, this is definitely your time to raise your hand or come off mute. Yes. Could you introduce yourself, please?
Hi, my name's Rita Campbell. I'm a Ward 5 resident, 71 years, young, and I have had a lifetime, maybe 40 years as a holistic practitioner. And I found that this experience we're having right now is like a whole polysystemic cascade of toxicity that is really undermining everyone's health, and all of these issues around premature aging, early deaths. If you look at all of the years of bioaccumulation, of having the layers of chemicals and metals and electromagnetic fields and what else? Oh, parasitic infections beneath people's awareness. Just as a population, our immunity is really depressed. And these are all hormone disruptors. That's the real culprit behind all of the cancer and diabetes and arthritis. And I had all those things early on. I'm a blood type A. I'm a non-secretor. And we're the most fragile of all the blood types. So I had all that disease expression early. So thankfully, and I have to maybe give thanks to all of the meditation I started back in 1971, I was able to kind of attract the resources that helped me solve these problems, because I could hardly walk up the steps from the arthritis that I had. And, I had acne, hair loss, vision loss, the litany of things. But the dental amalgams that were installed in me as a teenager, with all the shedding of the metals inside of my body. And then my parents were both smokers and drinkers. So even when the sperm met the ovum, there was a heavy metal load on the DNA level. So I was born dumbed down. And even though I was a pretty good high performer with my academics, I could have been even a lot better because a better decision maker about my life and everything. So not to go on, because I know you're on limited time, but the whole conclusion, after having all these miraculous healings, and clearing PTSD was like a big deal for me. I had a lot of trauma sites from childhood boundary violations. So when I look at the school system, just like Tanae said earlier, we need to have a screen, and also the other woman who was speaking earlier, this whole thing about educating the children. But we need to have a screen set up in the school system so that we can test for not only loads of heavy metals and chemicals and things like that, because everybody's drinking all these nanoplastics in their water, but the level of trauma that people are suffering beneath the awareness of their parents and themselves. You know, I didn't even realize I was suffering from trauma until I started studying it. So in the school system, it would be good to kind of start to identify people who have these levels of toxicity, because it's all tied into the level of violence we're experiencing, and the low academic performance, because the heavy metals stunts the growth of neurons. So that's going to compromise our cognitive abilities. And so it's not about what color you are. It's about all, you know, and each genetic profile has a different way of managing this stuff. If you're a blood type O, you can manage toxicity better, but nonetheless, even further down the road, you're still going to end up with the same thing. You're going to be dumbed down. So, and then your hormone disruptor, well, actually the hormone disruption turns on the genetic markers for cancer and diabetes. So nonetheless, that's my input, is basically we need to set up a screen, and I guess it needs to be at every developmental level, straight through adulthood. And I'm saying that if we could do that and start to drain the toxins out, it's going to take a long time to turn around all of these industrial polluters, especially in light of where this administration is going. So it behooves us to take this on as a do-it-yourself thing. And I can give out links for people to understand points of entries to start the detox process, because there's homeopathics, there's drainage remedies that come in spagyric botanicals. There are all these things out there that people can start to work with to address obesity. I had like a huge weight management problem, but I didn't connect it to the metals and all the chemicals, and also the lectins from eating against blood type. So I can just put my email in the chat, and I'll send out some of the links so people can at least have points of entry. All right then. So that's pretty much.
Thank you so much, Ms. Campbell. Yeah, you definitely got back to that kind of cumulative impacts of all these different, layers and layers and layers of things that we're also exposed to on top of the air quality itself. But we do have a question in the chat from Dr. Zooks, from one of our other board members. So Zooks, I don't know if you want to come off you and ask your question, or I could just read it from the chat. I definitely want to give you some time to speak. I haven't heard your voice in a while, so if not, I could just read it. But Zook said that they had a question about the park bench monitors. Is there a way to differentiate smokers versus industrial sources/traffic? And what she is worried about is it being okay to smoke in areas without pollution, but not okay in areas with pollution. So I'm not sure if one of the DOEE staff could answer that question.
In all honesty, I hadn't even really thought about that until Zooks asked about it. So, and we don't typically think about the pollutants that are in cigarette smoke in our daily work. So I think we're going to have to get back to you on that. I mean, obviously, a cigarette only lasts about 10 minutes or something. So I'm sure that if it is being picked up, that would be useful to understand. But I think we'll have to. I think we'll have to get back to you on understanding the pollutants that are in cigarette smoke.
That's just what I was talking about. Secondhand smoke, heavy metals, and chemicals.
I mean, I do know it's bad, but yeah, I just don't know how it differs from, car diesel exhaust or something like that.
Right. So yeah, as Melissa put in chat, please continue to think about questions you have for the board or DOEE. But if you don't feel comfortable coming off me or asking your question now, you can fill out the recommendations form. There is a section for questions then, and also provide your recommendations.
I think Sukes did have another question earlier that I was going to respond to.
Yeah,
She
go
said,
ahead.
I love what you said about having data to take action. Can you give an example what that could look like where additional monitoring data could help? Um, so at this point, we're kind of in prototype phase, I'd say. We we actually had our first experience trying to implement this. We have been here and there looking at the purple air map and seeing if we see anything striking. So far, I mean, honestly, it's been every, it's a couple ppb difference here and there. I mean, not ppb, a couple AQI difference here and there, but it hasn't been drastically different. But we did see one sensor that was much higher for after a weekend. So we sent compliance out to go take a look. They thought they saw some dust, but couldn't determine the location that the dust was coming from. But afterwards, we've since think we determined that we just found out that the sensor's gone bad. So I guess fortunately, it's probably not the result of folks breathing bad air, but we're able to use it, at least in theory, to be able to look at what's a sensor that's popping higher than the average sensor to try and get compliance out to find something that's going wrong. Now, at this point, though, we're still dependent upon kind of keeping an eye on the purple air map, which is not, a way to run the ship. So one of the things Henry's working on is, now this will only work with the sensors we have access to because we need access to the raw data to do this, but we want to set up alerts so that way we can, if something happens overnight, if something, I mean, because we have other work to do too. So, but we can get an email saying, hey, now check out the map. Look, something's going on. So that's in the medium term. But for now, yeah, we're just keeping an eye on the purple air map, and if we see something, we were at least able to do something the first time we saw something.
Thank you. There was another question earlier in the chat. I'm not sure if we addressed it from Michael Cohen. Sorry if I mispronounced your name. They said, I think they're referring to the purple airs. Is this only for owners, or can renters also do the purple air monitors?
As long as the renter has permission from their landlord, or or some sort of arrangement, that's fine. We just don't want to a situation where the a landlord's going to come back and say, "Hey, DOE, you damaged our property on installation or something." But if you have permission, by all means.
All right, we do have a hand raised, so you can go ahead, Shay Queen Darby. You can introduce yourself too.
Hi, I'm Shay Queen Darby. I just want to know, is there any written testimony that we can write? And who do we submit that to as far as air quality and environmental justice or injustice?
Well, we certainly in the long term can use support for these types of programs. And, if you want to support us in upcoming budget hearings, we won't say no. Obviously, the district's budget is challenged right now. But yeah, I think that at least in the short term, that's a point that's coming up probably in early May. I'd wager that. I don't think they've announced the dates yet. We also can use support. This is, I think, it was mentioned that, from that video we saw and what Dr. Phoenix was saying, the vehicles are an important part of the mix of what we need to address when it comes to pollution. And we do have funds that we want to get to get into certain communities. I think Ivy City is probably on the top of the list because we have funds for electrifying they call them reefer trucks, the refrigerated trucks. And we, making contacts with folks that might be interested in that money. And we also have some funds for electrification of other vehicles. We're trying to work with DPW. So, talk, testifying in favor of that, I suppose, could be useful too.
Thank you.
And I think another good site for that too would be the Aussie bus terminal that, they're bringing 250 buses into the Brentwood community. So I think some of that needs to be electrified as well. But yeah, and
I will know one thing there. As much as I would love to give them some of this money to electrify, they have to replace a diesel vehicle, and Aussie has all gas vehicles. So unfortunately, we can't use this funding for that. But they theoretically have gotten some money for electrification from other sources. But yes, those should, electrifying those would be good.
Yes, thank you. Zeus also mentioned please use 311 as well. So yeah, we will most likely have another event slash training on submitting 311 complaints. So this is the tool that the city uses to monitor, kind of bad actors within your community. So if you smell any odors, if you have any bad actors or nuisance issues like illegal dumping or whatnot, you could use your 311. And they would use that data to kind of interpret any actions that is needed. You have another related question related to the last question. Can you tell us about the larger air quality and environmental health advocacy this is part of? What are the policy changes, regulations, etc., that are underway from the organizations leading these efforts? So I guess that's either at us, out of
Yeah, I
RDC,
feel
but
like
also
I feel
police.
like you guys are going to have to answer that one. I think that's a little bit beyond what we could talk about.
Okay. I am curious to know what your answer would be. Um, but yeah, but if you're not comfortable, we can answer that. But yeah, at Empower DC, we're definitely uplifting some legislation moving through council, one being the cumulative impacts analysis bill. But again, you all could fill out the survey to get connected with some of these campaigns. But yes, this cumulative impacts analysis bill will address how permitting is happening in overburdened communities to kind of alleviate and require a cumulative impacts analysis. Uh, uh, thing to prevent more permits or permit renewals in overburdened communities to help alleviate some of the air pollution. We also have a eminent domain act moving through council to address a bad actor in the Ivy City community to address the longstanding grandfathering in practice that's happening nationally, but to definitely alleviate some of these harmful chemicals within the community. But of course, continuing to uplift DOEs and their air quality initiatives to address some of the things that are happening on the ground. But Joseph, I'm not sure if you all have any other projects that are underway that we should know about.
I would just say at this point, always follow we post everything on our website and in the district register when it comes to any permits or regulations. We obviously can't comment on any pending legislation. Yeah, I can't think of anything specifically that's going to be coming out in the very near future as far as permits of note. Right now, we're in a phase where we're, I guess, trying to implement some of the regulations we recently adopted, such as the odor control plans and our NOx rack reg, which is it's an EPA required set of regulations, but we made we put in stricter limits, in particular on natural gas powered boilers in the district. So we're trying to make sure that's all implemented, and that should, if you're near a larger source like what are some like the Capital Power Plant or um, uh, some of the hospitals and universities have these too. That should help a bit.
Yeah, I do have a question around the odor control plans, but I'll take a beat to see if any other of the residents had any other questions or comments before I ask mine. But I guess I'll go ahead. So with the odor control plans, I know within the regulations, they will also like trigger a permit process as well, for like the equipments that are being installed. So is there like a clear timeline of when that would be? Is it like after all equipments are installed, or are y'all working on drafting the permits?
Um, I I figured I should have. I knew you were going to ask this, and I should have looked up when the due date was. It for the one source I think you're most concerned about, the permit, the application will be due. It's either April 25th or 27th. So they'll have to have an application, and then we obviously have to review the application and write the permit, and that takes a while. And then there'll be a public comment period for the 30 days. So it's still a good bit off before you will see anything, but they should be submitting it in about a week and a half.
Thank you. Are there any other questions that you all have? We have a couple minutes, so we could definitely keep talking. I definitely don't want to keep y'all longer on this Tuesday evening. But I definitely am really appreciative that y'all are joining us today. And yeah, but before I close this out, definitely would take a couple more moments if anyone had anything else to say.
Well, I just want to say again, I'm thankful so much to the advisory board for all the advice that's been given, and I'm looking forward to the other advice that that'll come out in the final report. I think it's been really useful for all of us to hear from y'all and work together. I heard some ideas tonight, but it looks like I'm not going to keep talking because I see there's some questions from folks.
All right, Miss Perkins.
Hi, how everybody doing this evening? I had a question, or just a thought that that ran across my mind, in reference to how air pollution has been affecting everyone for a long, long time and down the line. So, they always talk about, you hear talks about, vaccinations and how it affects children. So I was listening to, I think her name was Miss Campbell, talking about the detox and everything and the metals and all that stuff, just informing us of what was going on, her health issues and how she overcame those by doing detoxes and everything. Um, with that being said, you have children with Down syndrome and autism, and it was said to be linked by possible. Somebody correct me if I'm saying the wrong vaccinations, but now, I'm new to this too, and I've been learning a lot of things, and a lot of times I'm quiet because I want to listen, and I just want to, just learn. I just want to be a sponge and learn. But that just ran across my mind. They had things related to vaccinations, and here we are talking about pollution and how it affects your sugar level, your blood pressure, your weight, your PTSD and other things, the asthma and the allergies and stuff. So that was one thing that just ran across my mind. This can possibly be a greater contributor to our kids with Down syndrome and autism and dyslexia and stuff and things to that matter. I just wanted to mention it. I don't know if it's really a question, but it was just really just something that was on my mind.
I would first say what Zooks might have some insights to you on the vaccine question. It's not my area of expertise, but I think there might be more to hear from her on that. But I will say there, as far as the health, as far as sort of like uh, developmental health and air pollution, there is I don't think they can say there's a definitive causation yet but there have definitely been an increasing number of studies that are showing possible correlations between air pollution exposures and you know, um, you know, various um, outcomes when it comes to mental health and learning. It's hard to say. It's not as conclusive as the connection between air pollution and asthma, or between particulate matter and COPD, or heart attacks and premature mortality, that kind of stuff. That's very defined. Whereas there's the scientists are still working on this one, but there's definitely been a lot more evidence that there is something there. So can't say definitive, but it's definitely something that's being looked at and possibly there.
And also miscarriages and low birth weights.
Yeah, that's on the list.
Yeah. Okay. Thank you. I appreciate it.
Okay.
I'm gonna jump to Miss Sabrina, then back to you, Tanae, if that's okay.
I want to say something also. I don't know how to put my hand up.
Okay.
Sharon. Okay, this is for Mr. Joseph. Mr. Joseph, you said electrifying buses that you can't do that right now for Aussie, but Aussie has been in Ward 5 for many, many years. So the only thing they're doing is coming from Ivy City to Brentwood. So we like kissing cousins, like right across the street. So I don't know why that Aussie organization wasn't, put in the for electrifying buses, like a
Oh,
couple of them.
sorry.
Yeah,
I think
because
sorry, Miss Edwards. Sorry,
you,
Miss
you
Sharon.
I'm finished. I'm finished.
Oh, I the Aussie can electrify the buses. It's that the funding that DOE has that could help with electrification can't be used to help them. We actually fought, I guess there was some IRA funding that was made available through these clean school bus grants, and EPA didn't want to let Aussie have access to the money because they only had gasoline vehicles, and we're like, EPA, no, 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 that law doesn't say that. You got to let Aussie get, apply for the funds. And they listened. So Aussie has gotten all the funds for electrification through other sources, but the money we all get, the money we have gotten to make available for the projects I was talking about can only go to vehicles if you're getting rid of a diesel vehicle, and so thus Ossie's not eligible for that specific pot of money. But I think they have plans for electrification, and they certainly have gotten some clean school bus grants from EPA too. So
All right. Thank you.
I hope that helps answer your question.
Yes, it did. I'm finished.
Thank you. Go ahead, Sabrina.
Thanks. Joseph, because we're talking about air quality, healthy air, need healthy our environment to be healthy. And the reason for the folks on this board is to express their health disparities because of the poor air quality in our communities. So when there's facilities, or we have idling trucks, idling buses, and just a slew of things that's making our air quality poor, and polluting facilities. How has there been any examples of DOEE enforcing that a polluting facility is either shut down, and I'm not speaking about one in particular, just across the board? Is there any enforcement being done for the idling or the polluting facilities, or
I will say, over the past 6 months, if not a year, we've really increased the
Did we lose Joseph?
Hey, Joseph, you're frozen.
Maybe reconnecting. I don't know if y'all noticed, but the Zoom did bump me out for like a quick second. So
Can you answer that while Joseph is reconnecting? Or do you have the answer to those questions?
Yeah, that would be more of a Joseph question. Miss Sabrina, I don't want to step on anybody's toes here and like, overspeak.
No problem. Okay, we'll wait on Joseph. You can go to the next.
yeah. Tanae, I don't know if you had a Joseph specific question or you did.
I
Okay, well
did
while we
have
were
a Joseph, but Kane may be able to answer this one since it's more so related to the benches and our recommendations. Do you know when the benches will be deployed to these areas from our recommendations? And is there an opportunity to add more? As we've heard other folks have said,
Yeah,
having them in like Southwest.
okay. I think the first question is when will the benches be deployed? So to answer your first question is
Yeah.
like right now we're working with DPR on getting like a blanket agreement to place some of these benches at various locations, and from there that'd be coordinated with like actually getting the benches themselves and like set up, run to start collecting measurements. So while I don't have an exact timetable, I can keep you like guys like up to breast on that. And
Okay.
the second question is, will there be opportunity for more benches? I mean, I think that'd be like funding dependent. They're pretty expensive, and I think that probably would be more of a Joseph and maybe like an Amanda question as far as like getting like more funding to like buy some more benches. But right now at the moment, I think we just have the floor. So
Yeah, at this point, I would not expect there to be funding for additional benches. You probably followed the news with what's going on with the district budget. And, we were using one-time grant funds from EPA, and you also probably been following the news from EPA. So we definitely want to keep the floor we're going to install running and get them in place. But beyond that, we will probably have to wait until another brighter point for more. Also, I think I was also in the middle of answering Commissioner Rhodes's question when my internet dropped out. Yeah, so we've been expanding our enforcement, in particular of idling, over the past couple months, partially through the citizen idling, because that's really made it, it's made it so that we can access more places, because we only have about, two inspectors, so they can only be in so many places at once. So having eyes, on weekends, in various neighborhoods, we kind of know where some of the hot spots are. So we tend to be able to focus on them since we're more likely to find idlers, but having the citizen or the resident idling enforcement program has really helped with that. And I can't quite tell if it's changing behavior yet, but it's certainly been we definitely strengthened that enforcement. Oh, I should put a plug while we're talking about idling. We're going to be launching our air quality awareness events. It'll be the full week in May and the first full week in May. And I forget what Amanda's going to have to tell me which day. But we're going to have have an online screening of a documentary called Idle Warriors. It's a documentary about the New York City residents that participate in their program. So I think it'll be neat. And man, what day is it?
That is Thursday, May 8th, and it's going to be at 5:30 p.m. It's a virtual showing. We're also going to include a little discussion about our own idling program. We don't have the link for it yet, but hopefully we will soon. And we'll post it both on our social media, but we'll send it over, make sure that Anthony and Maritza have it so everybody can get it. And can I just plug a couple of our other events? On
Go ahead.
Tuesday. Sorry, what's that?
I was saying, go ahead.
Oh, I was gonna say, I'm just doing it anyway, sorry. On Tuesday, May 6th, we are going to have what we call one of our Clearing the Air webinars, which is basically we're just, going to talk about what the air quality division at DOEE has been up to this year, and what we're going to do for the rest of the year, and we'll answer questions. It's basically just a meeting open to all district residents and anybody else who's interested, and that'll be virtual as well. And we'll get that link when it's ready. And on Wednesday, May 7th, we'll be out and about at some district metro stations handing out magnets on the air quality index. So you might see us then. And we've got the movie on Thursday, and we're hoping to have a few more other things that will keep you in the loop about. And all that week, also on our social media, we'll be posting little videos, information about air quality, just to try and raise awareness on air quality in the district and what people can do to protect themselves and their families.
Thank you for that. And
Anthony,
you
can I
all
put a
hit up.
plug?
Yes, go ahead.
Can I just put a plug in? For May 7th, there is going to be an allergy and asthma day on Capitol Hill. It's folks from all over the country visiting various Congress members, and you can actually make like a reservation to meet with various council members. I think this may be a great opportunity for residents to kind of lobby or, visit some of the folks that have not been speaking out or in taking, well, voting against the EPA funding and things like that. Like this may be an opportunity to show residents faces and express interest in, well, not interest, express concerns about the funding being removed from, you know, communities that are mostly impacted, just to have some face-to-face time. I placed the link in the chat for folks, and it also may be a good opportunity to just meet with our delegate at, and show her how DC residents are coming together on certain issues. But placed it in there. I plan on attending, and hopefully you all will be able to attend as well.
Thank you. I know Dr. Phoenix has also placed another event in the chat for April 24th, a virtual event looking at air quality and health with a guest speaker, Blaine. How do you pronounce her last name? Your mom? I should know this. Who's also a wonderful person who's very knowledgeable about air quality within the district and surrounding areas. So definitely attend that event, but also come and attend our events too. We're having a cumulative impacts events next week on Tuesday, cumulative impacts info session, and then we'll be wrapping up our long series of Earth Month events with our environmental justice tour in Ivy City. So you could come in person. You could check out, some of the burdens that the environment that the communities are facing, and learn more about the history of Ivy City on April 26th at noon. So definitely bring your walking shoes for that. And with that, I think I'm ready to close this all out. So thank you all so much for participating and being here. Thank you for the amazing questions. Thank you to the DOE staff. Thank you to the board members. Thank you to my amazing Empower DC team for holding me down. And yeah, with that, thank you all so much. I hope you all have a restful and good rest of your night. And hopefully you all are off tomorrow and can chill out just like me.
Good night, Anthony. Good night,
Good
everybody.
night. Good night.
Have a good Emancipation Day.
All right.
Thanks.
Everyone.
Bye-bye.
Bye-bye.
All right.
Thank you so much.
Thank you.